Good morning. This is Jean Eaton, your practical privacy coach with Information Managers. We're going to get started our presentation today about preventing big fines or worse for your healthcare practice. Learn how to plan a privacy impact assessment. And this is an exclusive webinar for Chima members. So as a Chima member myself, I'm delighted to provide this opportunity for Chima and students. So please enter in the chat your name and where you're hanging in from or calling in from or joining us from this webinar. There's lots of different ways that you can join us. And we want to have you enter your name in and let us know where you're participating from. I'd love to be able to hear from you, that you can hear me, and I'm going to share my slides with you in just a moment. So we've got people signing into the webinar, and we'll give them a moment to log in. Now, in the chat on the webinar, you will see that there is a link for the Learning Resources Guide. So you can copy and paste that link for the Learning Resources Guide and access the Learning Resources Guide right off of your browser. Now, if you can't access that right now, that's not a problem. You'll be able to access that later after the webinar. There will be a replay for the webinar. And in the reminders for the replay, you will also receive the links for the Learning Resources Guide, so you can access that a little later as well. I'm just going to ask you to sign into your chat button on the side of your screen, or perhaps it might be below your screen. And we'll share the slides here. Okay, so now if you can let me know if you can see the slides, that would be gratefully appreciated. I always like to know that people can see what we're sharing, and make sure that the technology is working for us. Okay, I can't see the chat, but Megan is going to help me with that chat. So I'm going to ask Megan to help me manage the chat today, because I can't seem to see this, see the chat entries. So we're going to get started with our webinar today. So our webinar today is to talk about prevent big fines or worse for your healthcare practice. And we're going to learn how to plan a privacy impact assessment. My name is Jean Eaton of Information Managers, and it is my honor and pleasure to be with you today for this exclusive webinar for Chima members and students. Today, our topic will be talking about planning a privacy impact assessment for your healthcare practice. Now, you might be working for a larger acute care hospital or healthcare provider. You might be working in a smaller private primary care center. Any of those situations, anytime that we're dealing with health information or patient information, we want to make sure that we have a privacy impact assessment. And the PIA should be as commonplace to a healthcare practice as a business plan is to a business. But what I find is that most healthcare practitioners don't know this, and often don't know that a PIA is usually part of their professional college requirements, and often even a regulated legislative requirement. So it's very important to do a privacy impact assessment to prevent malicious errors, omissions, or attacks that could result in fines and even in jail time for businesses, healthcare providers, employees, or vendors by completing a privacy impact assessment. So this free webinar is exclusive to the Chima members. If you are a health information management professional that currently works in these areas or a student, I want to be prepared for your next opportunity. This webinar is for you. If you are currently a privacy officer, a risk management officer, or participate in planning of committees or implementation of electronic medical records, information sharing, patient portals, or new technology. If you are a clinic manager, a practice manager, or practice in a private healthcare practice or in a larger facility run by a health region. If you are a health records manager or a supervisor, or work for a vendor that supports healthcare practices, this is the webinar for you. I am a certified health information management professional, a Toastmaster, and an entrepreneur with a business administration degree in healthcare administration. I am your practical privacy coach. I'm constructively obsessive about privacy, confidentiality, and security when it comes to the handling of personal information, particularly in primary healthcare settings. I have customized and delivered privacy training program for privacy officers, records management professionals, implementation teams, and healthcare providers across Canada and the United States. Over my career, I've worked in small to medium-sized acute care hospitals across Canada as a manager or director of health records, data analyst, EMR implementation team lead, case costing, and a variety of other positions for well over 20 years. In the last 10 years, I've been an independent entrepreneur practicing as a health information management professional in privacy and security in primary care, focusing in Alberta. My consulting service includes physicians, pharmacies, chiropractors, and other primary healthcare providers, healthcare regions and regional health authorities and the Ministry of Health, and primary care networks. So in today's presentation, we're going to get through a great deal of information in 45 minutes. You will have access to the Learning Resources Guide, and if you check the chat box, you can see the link to allow you to have access to the Learning Resources Guide. If you're not able to download the Learning Resources Guide this morning, that's okay, because we'll send you the link after the event too, and you can access it at that time. So we're going to talk about a great deal of information today. And we're going to talk about the 5 manageable steps about every privacy impact assessment. What is a privacy impact assessment? When do you need a PIA? And the 3 biggest myths, mistakes, and problems that are going to many people believe about privacy impact assessments. And importantly, the 3 PIA questions that people should ask but don't. So what exactly is a privacy impact assessment? The privacy impact assessment is a process that assists custodians to review the impact that an implementation of a new administrative practice, information system, or change to existing practices or systems relating to the collection, use, and disclosure of individually identifying health information that may have on individual privacy. So it affects any time that we collect, use, or disclose information, and any time that we change the systems that are involved in that collection, use, and disclosure of systems. A privacy impact assessment describes the information flows in the project, identifies the legal authorities that allow for the flow of information, assesses potential impacts and the risks to privacy, and identifies mitigation strategies to minimize these risks. The process is designed to ensure that the custodian or the authority representative for the healthcare region evaluates the new practice or proposed changes to ensure compliance with the Health Information Act, as well as assessing the broader privacy implications for professionals and for the individuals. Often, the privacy officer completes the privacy impact assessment. However, the custodian or the CEO is responsible for having the privacy impact assessment completed. So I'd like to pause for just a moment and ask you who in the group here has completed a privacy impact assessment. So enter 1 if you've never done a privacy impact assessment. Enter 2 if you have not done a PIAA but expect that you will do one in the foreseeable future. And enter 3 if you have done a privacy impact assessment. And I'm just going to change the slides on my screen while we wait for the results coming in on the chat about doing the privacy impact assessments. So we're going to come back to those results in just a moment, and we're going to continue with the presentation here. So doing the privacy impact assessment is absolutely a process. So you're going to start by looking at your policies and procedures that you have in the department or in the healthcare system that you're working in. Then you develop those policies and procedures and best practices and take a look at your legal responsibilities. And at some point, it gets accepted by either the CEO in the organization, or you might need to have that reviewed and assessed by an external regulatory agency. And you do this again and again until all of the different steps are completed. Now, you're never done this and walk away from it. We do need to be able to go back and review the information. So every time that you've got a new change to the technology or the workflow or the other ways that things get shared between other stakeholders, you need to go back and review that privacy impact assessment. So in Alberta, there is a requirement for custodians or healthcare providers to submit an completed privacy impact assessment to the OIPC, the Office of the Information and Privacy Commissioner. Now, many provinces also have similar legislation requirements and have a similar organization like the Office of the Information and Privacy Commissioner. So it does vary about the regulations from province to province and between Canada and the United States, but these are the generally principles that happen on a regular basis. So I'm going to refer to a couple of specific scenarios in Alberta, but know that they generally apply to most jurisdictions across Canada and the United States. So the purpose of a privacy impact assessment is to protect personal health information. It's also to protect and ensure that we're protecting that information at each of the different stages of collecting, using, disclosing, and the retention and the storage of that personal health information. It's also important that we make sure that we ensure access so that the individual or the patient has access to their information. And this is a really key point about privacy impact assessments. We want to make sure in our integrated service delivery, particularly when you are sharing information or perhaps sharing services from the family physician to a hospital to an outpatient care center, or perhaps a specialist consultation visit, where will the patient have access to their health information? And do all of the stakeholders know that? So there's nothing more frustrating from a patient's point of view that they want to get a copy of their consultation from the specialist office, but can't find out who's authorized to give them that information. On the other hand, if you're working in the health records department and find out that someone else is handing out records from the patient to the patient and you don't know about it and you can't track it, that creates a problem as well. So this is one of the things that I find is one of the biggest advantages about doing a privacy impact assessment, and why it's so important to have that health information management professional involved in that process is we look out for those patients. We want to make sure that we know who has access to the information and who is disclosing that information, and making sure that they disclose it properly and have it properly documented. And that looks out for the patient as well. So this is a really key point about that privacy impact assessment. And this is one of the things that health information professionals have a key role in. We want to know beyond a shadow of a doubt that all of these key steps have been done and have been well documented. And the best way to be able to do that is to take an active role in doing the privacy impact assessment. So having that privacy impact assessment is an important piece to make sure that all of the stakeholders understand the roles and responsibilities, and it's clearly documented about who is going to do what, and then you can train to it appropriately. So what triggers a privacy impact assessment? Now, the legislation changes from jurisdiction to jurisdiction, but generally, any time that you have a new information flow, you have a change in technology, a change in legislation, you should be asking yourself, are there any new risks to privacy of health information? Now, here's a really important part about privacy impact assessments. Asking the questions is the most important part. You might say, gee, I wonder if that triggers a privacy impact assessment. And then you start to ask some questions. And it's okay to come to the conclusion, you know what, we haven't made a significant amount of changes that a new PIAA is required. That's a really important process and a step to know. You've taken that careful consideration and determined that a PIAA is not required. You might also determine that a PIAA is required, and these are some common scenarios that do trigger a privacy impact assessment. You should consider undertaking a PIAA in any of these situations. You may report the PIAA internally to your organization and to your stakeholders. You may not have an obligation under legislation to submit it to the OIPC or to a regulatory agency, but you do have a requirement to your professional college regulators and certainly your patients and business partners and owners that you've asked the important questions and you've documented those answers. In Alberta, under the Health Information Act, the submission of the privacy impact assessment to the OIPC is mandatory and must precede implementation of your new system or practice. The Health Information Act also requires periodic review. So you must review to your privacy impact assessment on a regular basis. And the rule of thumb is at least every 2 years. And we know that technology changes on a regular basis. So 2 years may be too long. You need to take a look at the things that change in your practice, whether it's new technology, new hardware, or perhaps it's the way that you do the workflow that has changed. You need to review your privacy impact assessment. Now, one of the nice things that I like to be able to do is when we have new employees coming into a practice, to be able to review the documentation, the policies and procedures as part of the orientation for the employee. But it also provides a great opportunity to be able to review the privacy impact assessment. Now, every time that you go through that review process, somebody should be documenting that the review was undertaken and what changes, if any, are required. The changes may be small, they may be significant, but you need to document what those changes are. So who in your organization is responsible for documenting those changes to your policies and procedures and your privacy impact assessment? So I'd like to ask you to enter that into your chat button now, that you can let me know who in your organization is responsible for documenting those changes. Oftentimes, it's the privacy officer. In a really large organization, you may have many privacy officers, or maybe there is a privacy office. It might be the director of health records. It might be the director of information systems and technology. It might be a shared responsibility to a management group or a user group. There are many different ways that you can implement the process of who is responsible for doing the privacy impact assessment. But what is important is that you understand how that is applicable to your organization and that your employees know who is the responsible individuals. If you have a complaint, you need to let the patients know who they can make a complaint to. So if a patient has a complaint about how their information is being collected, used, or stored, or how they have access to information, who is that person going to make the complaint? And you need to make sure that your front office people at the reception desk, at the switchboard, know how to direct patients' complaints and who to contact and who to call. Privacy impact assessment amendments. If your original PIAA was accepted by the OIPC, you may be able to do an assessment or an amendment in a very simple and straightforward way. You sometimes just required to do a cover letter and change the name of your privacy officer, for example. Sometimes you be able to enter a short report to the Commissioner's office saying, we've reviewed our policies and procedures recently, and almost everything has changed except for this bit. And then you provide the amendment about that bit that has changed. Sometimes an amendment is a significant piece of work and requires you to go through that PIAA process again. If you are working for a large organization, you might have a privacy impact assessment. You might have many privacy impact assessments. So the privacy impact assessment process is something that changes from the size of your organization and the types of the systems and the number of stakeholders that you have included in your practice. So I'm going to ask Megan to let me know from the chat about how many of you have previously done a privacy impact assessment, so that we can share that information with you. And we're going to go into actually planning a privacy impact assessment. So there are 5 key steps to planning a privacy impact assessment. So the first step is the project description, then policies and procedures, personal health information flow, the risk analysis, and the legal authority. So in our presentation today, we are going to talk briefly about each of these 5 key steps. So it looks like about 7 people who have joined us on our webinar today have currently done a privacy impact assessment. So it's great that we've got some people on board who have done a privacy impact assessment, but it's also really interesting that there haven't been a lot of people that have done a privacy impact assessment. And this is something that I see on a regular basis, and it's a great opportunity for health information management professionals to be involved with doing PIAs, and we're going to talk about that in our presentation today as well. So the first step about doing a privacy impact assessment is doing the project description. And this is a really key important step, and I don't want to trivialize this or take this lightly. Having all of the key stakeholders in the process involved in coming to an agreement about the size and the scope of the project description is a critical step about doing that privacy impact assessment. And this is something that HIM professionals, I think, have a great opportunity to be able to do and contribute to that PIAA process. You know all of the different people in that process who have a hand on the collection, use, and storage and access to that information. So they should be identified as stakeholders and have an opportunity to contribute, to review, and accept the project description for your privacy impact assessment. And this is going to help you determine the size and the scope of the project and will help you with other project management related skills. The next step is the policies and procedures. And who else but health information management professionals are excellent at doing policies and procedures. So you need to gather all of the policies and procedures that talks about the privacy, confidentiality, and security of the personal health information in the project. If you are missing some policies and procedures, you're going to need to write them. So this includes the information about how the information is being collected, who collects it, what is the training provided to the people that are going to collect the information, what information do you provide to the patient or the person that's providing you the information about how the information is going to be collected, used, and disclosed. All of those areas about confidentiality. How are you providing training to your staff to make sure that only the right people access it at the right time to be able to do their job and nobody else? How are you going to monitor and supervise that? There might be some technology, and there will often be a combination of both technology and human interactions, or the education and the training, the monitoring and the supervision. And remember that these things happen throughout the lifespan of the project and beyond, because we also need to make sure that we are managing the archiving and retention and that entire life cycle of that personal health information. It's really easy and a common mistake that we get really excited about the next project, or we're really focused on all the work that needs to happen to make the next stage in the project happen, and we forgot to go back and manage the information appropriately when we closed the last project. Or maybe we didn't close it properly. Maybe we didn't retrieve all of the information. We didn't document that the life cycle had ended and that it's been closed and properly destroyed. So the policies and procedures is a step 2 in your PIAA plan. Step 3 in the PIAA plan is determining that personal health information flow. Now, this is an information flow diagram, and an information flow diagram is not an IT architecture diagram. It's not even a workflow diagram. It is, how does the information go from one stakeholder or one virtual four walls box to another for every time the information is collected, used, and disclosed, or shared between other individuals. So the information flow diagram is a piece of work that requires pen and paper to start with, so you don't need to have any fancy drawing technology to be able to make this work. Pen and paper continues to work just fine. But it does require a lot of thought about how does all of the handoff happen throughout that project. This is also a really great way to be able to go back and to your project description and make sure that you've clarified the scope of the project and that the scope of the project is captured in the information flow. The 5 steps in the privacy impact assessment plan is a very iterative process. And we often find that when you have identified the project description and then get to the point about doing the information flow diagram, that there are things in the information flow diagram that wasn't included in the project description. So this is a great time to be able to get your stakeholders in the room again, to be able to take a look at the project description and the information flow diagram and make sure that they align. Are there new things that have been identified? Are there things that have been dropped or deleted? And there frequently is. So one of the things that I want to suggest to you when you're doing a privacy impact assessment, and particularly the information flow diagram, is don't worry at the beginning about making this really pretty, because you're going to make a lot of changes on this diagram as time goes on. So pen and paper works just fine. Don't get stuck on the technology and wait for the best software to be able to demonstrate the information flow diagram. When you have the details determined on that information flow diagram, then you can outsource it and get somebody else to help you to make it look pretty. Pen and paper works fine most of the time to get started with. Okay. Lost my mouse. The next step in the PIAA plan is step 4 for the risk analysis. Now, this is something that HIM professionals are particularly really good at. We can take a look at all of the steps in the collection, use, and disclosure of personal health information and determine what are the potential risks for the information to privacy, confidentiality, and security. Then these are the areas where we talk about the 3 types of risk, whether or not they are administrative, technical, or physical risks. And you don't have to be the master of technology to be able to determine these risks. This is where you can talk with other people on your team. And if you've got a IT or heavily technology dependent project, you're going to rely on your IT experts significantly in this particular project. So you're going to take a look at every step on your information flow diagram and think about all the bad things that could happen about the privacy, confidentiality, and security of that information, and what are the mitigation strategies, administrative, technical, and physical, that you're going to put into place to prevent those bad things from happening. So I like to think that we're a lot like astronauts going into space. Anticipating all of those bad things is not depressing. It's not a bad thing to do. It actually makes you more prepared and more confident to be able to move forward. So the risk analysis needs to be a comprehensive document, and there are a number of different strategies that you can use to create that risk analysis. There are a number of tools that are publicly available to help you with that, and you're going to need to customize it so that it is appropriate for both the size and the scope of your project, and also for the size and the scope of your facility and the healthcare organization that you work with. So the risk analysis is step 4 in the PI planning a privacy impact assessment. Now, step 5 is legal authority. We need to have the legal authority to be able to complete all of these steps for your privacy impact assessment. The legal authority goes back to the information flow. So you need to determine for every time that you are handing off the information, every time that you are sharing it with another stakeholder, every time the patient needs to have access to the information, what is your legal authority to collect it, to use it, and to disclose it? And this means that you need to identify the legislation that is applicable, and you need to find and cite the particular section of each legislation that allows you to collect, use, and disclose. So it's not good enough to say, oh, we can do that because the Health Information Act says that we can. You need to get to a very specific degree of detail. We can collect personally identifying health information directly from the patient because it says in the Health Information Act under Section 27, Sub 1, Sub G, that we are authorized to do that. So the legal authority is something that you might need additional resources or additional people in your team to help you with. You might need to go to legal counsel on if you're working for a larger facility. You're going to have to be very clear in identifying who is authorized to access, collect, use, and disclose that information. And that means going back to how is the organization incorporated? Is it a sole proprietor ownership? Is it an incorporated LTD? Who are the directors? Who is specifically authorized and responsible for doing each of these steps? So the legal authority is a piece of work that typically is done by a small group of people. The project description and the information flow and the policies and procedures requires those members of your stakeholders and the members of the team that are going to be involved in developing that project to a much greater deep level of involvement than doing the legal authority. So these are the 5 steps of doing the privacy impact assessment. You start with the project description, policies and procedures, the personal health information flow, the risk analysis, and the legal authority. All of those pieces of the puzzle come together to create your privacy impact assessment. So these are the 5 areas that you need to be able to plan. In your Learning Resources Guide, I've given you a mind map for each of these steps, and I've identified some of those key steps in a project timeline. A privacy impact assessment takes a significant amount of time to be able to complete it. And as a rule of thumb, it probably should be done 3 to 6 months before you implement a new project. You want to start it when you have signed contracts, are really close to signing contracts with new technology vendors, if it's a technology project, before you sign contracts with stakeholders for outsourcing services between the healthcare hospital and a surgical unit or a specialty consultation service that you're going to be sharing patients with. It takes that amount of time to be able to help you get the information that you need from all of those stakeholders and to be able to fold it into the mix. You also want to start that PIAA process before a lot of these fine details have been finalized, because you are going to find things in your PIAA process that you want to have amended to the documents before you sign them. So a vendor for a privacy impact assessment, whether it be a computer network vendor or somebody who's providing outsourced healthcare services, or perhaps outsourced other types of technology, retention of documents, for example, those contracts need to have some key words that you're going to have from your privacy impact assessment and your legal authority to go into those contracts. So remember that PIAA process is an iterative process. You're going to find out things in that planning that PIAA that are going to have an impact on the contracts that you need to sign with those external stakeholders. Doing the PIAA early enough in the process is actually going to help you refine your criteria for what you consider is a good vendor for this particular project. If you have something that is very sensitive, that you're sharing a lot of information, and the vendors that you're looking at needs to have criteria about making sure they can handle the encryption, that they've got a privacy officer in their organization, that they have training available for their IT employees if you've got a computer network system that you're outsourcing. So it is an iterative process. You want to start about 3 to 6 months before your planned implementation, because you're going to find out some things in that PIAA process that's going to have an impact for you. Now, really quickly, I want to be able to review some of the myths, fears, and questions that people should be asking about doing a privacy impact assessment. So the 3 biggest myths about doing privacy impact assessments. A privacy impact assessment is useless administrivia. Now, I hear this all the time. Why do we need to do a PIAA? It's just another roadblock in our implementing the project. But as you can see, it's a really important documentation process and a really key part to be able to communicate between stakeholders about what you're doing. You might go through the PIAA process really smoothly and find that you don't have any bumps, and that's great. You've been able to document that you've had this well thought out. But you will often find that there are things that you didn't think about, or there's been some miscommunication, or some lack of communication between those stakeholders, and that PIAA process is going to help you. So absolutely, PIAA process is a very useful thing. Oftentimes people don't think that they need to do a PIAA, or someone else has done the PIAA because you just assumed that the other person would do it. So going back and checking to make sure that the PIAA is done, that you've got a copy of it, and that you signed off on it and you agree to it, is another important part about doing that PIAA process. Myth number 3, ignoring a PIAA and that things won't get out of control. If you know you got to do it, but you really don't want to, you don't have the time, nobody's stepped up to be able to become the expert in your organization to do the PIAA, and you just bury your head in the sand and hope that it's going to go away, that's not going to help you. that's a myth. If you don't do a PIAA, you are going to find that things are going to get out of control. If you do a PIAA, you're going to be able to have your a more responsive organization and to be able to manage those situations as they come up and prevent situations. If you don't have a PIAA in place and you haven't asked all of these good questions at the right times and had the right process documented, you will find that you have a privacy breach. And if you have a privacy breach and you haven't got it documented, that you anticipated those risks and you put in reasonable mitigation strategies to prevent those risks, you are going to have fines for your organization. You might have criminal charges in place. You might have college reprimands in place. So it is important that you do that privacy impact assessment process. The three biggest mistakes that I find about doing privacy impact assessments is organizations not realizing that not building privacy into the healthcare practice can be a breach of regulations and the laws. So if you make the mistake about not building these practices into your business flow and how you do your training, you're going to have to pay for that down the road. So pay me now or pay me later. You need to get these processes in place. Mistake number 2, not preventing malicious errors, omissions, or attacks. Asking the right questions in the PIAA process, documenting reasonable mitigation strategies, and being able to train and make sure everybody knows their roles as a key important benefit of doing that privacy impact assessment. Mistake number 3, not starting the privacy assessment process at the right time. This is really important. A lot of people leave it way far to the end after they've signed the contracts and they've already decided what their workflow process is, and they're in the hiring stages for this new project without realizing that they don't have the legal authority to do something and they have to go full stop. Or maybe they get to the PIAA process and they realize that the PIAA process is important, it's a valuable thing to do, but they can't get it done in time for their go-live date, so they need to adjust the go-live date. So finding the right time to do your privacy impact assessment, and sooner is better, is a mistake that I often see that people make about doing privacy impact assessments. 3 biggest problems about doing PIAs. People want to do the right thing. We want to be good at our jobs and do the right thing at the right time. But often when regarding PIAs, people don't know when to get started, or they don't know how to get started. They don't know who to call, and they don't know what types of questions that they should ask and what type of answers that they should get. And they don't know how to put all of these pieces together in a document for a submission document, either internally or to an external regulator. Now, these are the top 3 concerns that I hear over and over again from people who know that they have to do a PIA, but they don't know how to do a PIA. So one of the people that learned how to do a PIA from me says that I attended the Privacy Impact Assessment Walkthrough Workshop for ARMA members. Jean shared resources and ongoing networking opportunities. The biggest benefit to me is knowing that there is help out there moving forward with our privacy impact assessment responsibilities. And that was from Ellen Sauvé from Parkland County after she did a PIA program with us. So 3 questions that all healthcare practices should ask but don't. The first question that you should ask is, how can I use the PIA assessment to improve our policies and procedures? Build privacy into your business practices and the way that you implement and plan a project. And if you take it from that perspective, then the PIA process isn't onerous. You're getting multiple benefits out of doing that PIA process. You should also know what triggers a PIA. And every time that you have a change in the technology or the information flows, or you've got new stakeholders involved, you should be asking, do I need to do a privacy impact assessment? You should also be asking your vendors or your business associates if they have done a privacy impact assessment. When I spoke with a client recently about the importance of privacy impact assessments and the launch of our new course, Bill Stowe said, that after purchasing the e-course, Protect Your Practice, Your Assets, and Your Patients with Privacy Impact Assessments, when Jean told us about the e-course and explained how the course will help us better understand the Health Information Act, our responsibility as healthcare providers, and our relationship with our vendors and partners, I signed up right away. Thanks again. It is no doubt that we have hitched our wagon to a shining star. And Bill, I'd like to thank you for joining us for the course that starts on January 12th. And I'm thrilled that you can see the value of doing the privacy impact assessments. So what will a PIAA do for you? The PIAA process will help you to document and meet the standards of practice and regulatory compliance. It will help you to select the best vendors or solutions for your practice. It will clearly document your procedures and facilitate discussions with stakeholders. So by and large, it is far greater value the process rather than the documents that you're going to get at the end of the day. Having the discussions and clear communications is a key part about doing the privacy impact assessment, and certainly one of the key benefits about doing the PIA. Privacy is good for business. How we set up our business workflow, our data collection, training employees, and sharing information with stakeholders are all key components of privacy, confidentiality, and security of health information. Creating and reviewing a privacy impact assessment supports the effective healthcare businesses. So whether or not you're in a private independent practice or you're working for a municipal organization or a healthcare authority, privacy is good for business, and doing a good privacy impact assessment is a good business opportunity. It is also a great opportunity for health information management professionals. So a PIA will help you to improve all of those things. Now, I've helped hundreds of physicians, chiropractors, pharmacists, and other healthcare providers complete their privacy impact assessments. I've helped them to get these benefits from their customized PIAs. Now, I've visited hundreds of practices across Canada, but time and geography limit my ability to visit each healthcare practice that needs a PIA. And our webinar today just doesn't give me enough time to be able to give you a lot of the information that you need to know about doing privacy impact assessments. So I'd like to be able to introduce you to the e-course, Protect Your Practice, Your Assets, and Your Patients with Privacy Impact Assessment. So this online interactive course will help you to learn everything you need in order to review, amend, or create your own PIA. Each module includes a weekly live webinar, as well as templates, tools, and resources and 2 common case studies to build on each week. You can use these scenarios to guide you through that PIA process. And as a health information management professional, it's going to help you prepare for the role that you currently have in your organization, and perhaps opportunities for you to be able to stand up and raise your hand to say, I understand health information. I understand this project. I'm really good at project management and leadership skills. I know who the stakeholders are. I understand the workflow. I understand the importance of managing that health information. So this is a great opportunity for you as a health information management professional to get involved and to learn some additional skills that are going to make you feel comfortable to say, I can do the privacy impact assessment. Now, here's something that's really important. There aren't a lot of people who have done privacy impact assessments before. So why don't you become one of those people that have taken that initiative to feel comfortable to say, I can do this. Everybody else around the table is waiting for someone else to volunteer, and you can be that person. You can be that go-to person, and it's going to be able to help you in your career path and to be able to develop those opportunities for a privacy impact assessment. So I want you to be successful to create your first PIA or to create a PIA for that new project. I want to give you advice, training, tools, and resources to help you do that. And I want to be able to help you with the networking to continue that process. So this is why we've developed the online interactive course that you can join for learning more about a privacy impact assessment. So if you haven't done a PIA before, even if you haven't, isn't in your current job description to do the privacy impact assessments, this is something that you can take and learn that process so that you can be ready for that next opportunity. Now, we have 2 case studies in the course, so if it's not something that you're currently involved with, I'll provide you some case studies so you can get some real hands-on experience and learning about doing a privacy impact assessment. The online course starts on January 12th, and there are live webinars that happen for each week of 5 weeks. Now, I know that not everybody is going to be able to participate on that online course, and that's okay. So we've provided replays for you. So if you can join the live webinars, that's fantastic. If you can't, that's okay, because you're still going to have access to the resources offline to be able to participate. Now, we've done a number of e-courses, and this is a refreshed version of our PIAA e-course online. So we have a lot of the technology in place and the skills to be able to deliver comprehensive e-courses that are going to be useful for you. Now, you can also use these for your Chima CPE credits as well. So in the e-course, you will get a learning resources guide for each module, checklists to help you plan your PIA, a mind map of the entire PIA process, project timelines, checklists, case studies, explanations, and real-life examples, and risk and management assessment templates, and some additional tips, tools, and opportunities that are being provided from my network of affiliates who are going to provide you tools that to make the job easier for you. If you are a healthcare provider, a practice manager, and this is your first PIA, or you're a health information management professional who thinks that this is an opportunity that you can use in your career practice, this course is for you. If you are a vendor, this course is for you. In this course, we're offering a lot of bonuses. You get 3 open office drop-in group calls. So if you can't join the live webinars, you can join the drop-in group calls, which will be provided at another time, so that you've got one-on-one group opportunities to ask your questions and get unstuck. We are providing checklists to update your PIA specifically to the Alberta Netcare portal, and the opportunity to join a private LinkedIn group for additional networking. So this course is available on January 12th, and the course for the starts at $450. But wait, we've got some more bonuses for you. If you are currently a member of the Information Managers Network, you get the membership discount. I also have for you early bird registration pricing. So if you register for the course before January 4th, you can use the coupon Happy New Year to get $100 off. You also get complimentary access to the online course, Privacy Awareness in Healthcare Essentials, offered by our business partner, Corridor Interactive. You will have almost instant access in a couple of business days to the course, and you will have 3 months to be able to try out the course and see if this is a good solution for you or for your organization. Now, exclusive to Chima members today, you can use the coupon code Happy New Year and get $100 off the course, and that gives you the course value starting at $450. $100 off is $350. Now, for Chima members only, I'm giving you an additional 25% off, so you save a further $87.50 using the coupon code Chima PIA. So you're not paying $450. You're not paying $350. You will pay just $262.50 to get access to this online course. So as a Chima member or as a student, you have access to be able to purchase this course, and the link is being provided to you in the chat box, and you can just copy it and paste the link into the browser, and you'll have direct access to be able to purchase this course online. If you've got questions, if you're not sure if this course is for you, please contact me by email and I will help you to answer those questions and see if this is the right choice for you. So as a Chima member, we've talked today about planning a privacy impact assessment. I've given you the 5 steps to managing a privacy impact assessment, and in the Learning Resources Guide, we've got a summary of those 5 steps, some additional online resources that are available to you for free from information managers and other resources. And I've also given you a template about planning out a timeline for doing your privacy impact assessment. I would love to be able to work with you some more about doing privacy impact assessments. So if what we've provided for you today is a great opportunity for you to get started and you want to take that next step, please consider joining us for the course, Protect Your Practice, Your Assets, and Your Patients with Privacy Impact Assessments. Remember to use the coupon codes. You can use both Happy New Year and Chima PIAA to get access to all of those resources at half the price of the course, but you need to register before January 4th. So you get the 5 modules, you get the replays and the resources, and you get access to all of those replays and resources for up to at least 6 months. You have the open office phone calls, live phone calls with me. You get access to Alberta's Netcare portal checklist, private LinkedIn group. You get access to the Privacy Awareness in Healthcare online course that is offered by Corridor Interactive. And if you are a vendor, you have additional bonuses to be able to work with me to develop a branded privacy impact assessment readiness package. So I'm going to ask you to enter any questions that you have in the chat, and I'm going to ask Megan to forward those questions to me so that I can better answer those questions. We've run out of time, so I don't have a lot of time for Q&A. I'm going to stay on the line to answer your questions. If you have to leave and you've got a burning question that you want to ask me, please enter your name and your email address in the chat, and I will answer your questions after the seminar today by email. You can also email me directly at jean@informationmanagers.ca, and I'd be happy to answer your questions directly. Now, I'd love to hear what you think about these 5 steps for planning a privacy impact assessment. What did you learn today? What have you learned about doing a privacy impact assessment? And perhaps what questions would you like us to address at another seminar? So enter the information into the chat, and I will be able to review it after we close our live webinar today and get back to you and respond to your questions and answers. I'm sorry I'm not able to do that today, but I can't see the chats that you've entered into the chat function. So sign up for this e-course. The link for the course is provided in the chat, and you can just copy and paste that into your browser. You can pay online, and you have the opportunity to pay by PayPal. You don't have to have a PayPal membership. You can transfer money from your bank account or pay by Visa or MasterCard using that PayPal functionality. If you need me to send you an invoice and you want to pay by check, we can do that as well. Just send me an email at jean@informationmanagers.ca. Let me know that you participated in the webinar today and that you have that important coupon codes, Happy New Year and Chima PIAA, and I will provide the invoice for you so that you can pay that by check, by mail. So the benefits for the early registration expires on January 4th. The course starts January 12th. So please let me know if we've answered your questions about planning a privacy impact assessment. And if you've got any additional questions, please enter them into the chat on the webinar. And I can't see them at the moment, so I can't answer them live on the webinar, but I will answer them after the webinar has concluded. So it is a pleasure to have you joining us for planning a privacy impact assessment. This exclusive webinar provided to you for Chima membership and for students with Chima. Have a great new year. I'm looking forward to working with you in 2016, and I am looking forward to your questions. Thank you very much for joining us today. This is Jean Eaton, your practical privacy coach with Information Managers. Stay tuned.